energy metabolism, the way we make energy, is so important, and it deteriorates as we get older. The enzymes that are involved get slower, they get more sluggish. The ability for our body to detoxify gets worse as we get older as well. And so we get a building of rust in the system. So our mitochondria are our energy producer. We have many of these in our body. And for me, the through line there is on the hyperbaric side. Hyperbaric therapy floods the body with a significant amount more oxygen. And what happens with all that oxygen is the big question. You're trying to make energy with that oxygen for sure. But not only do you make energy, but you also make waste products of energy metabolism overall, meaning that you create oxidative stress. You create reactive oxygen species, free radicals, as a result of a flood of oxygen. But even on a regular basis, you and I right now, we're making energy all the time. And we are also making the waste products of energy metabolism. Hyperbaric therapy works in multiple ways, but one of the major ways it works, Garrett, is by creating oxidative stress. And that oxidative stress then causes a shift in what's happening underneath in your body, including stem cell release, anti-inflammatory, anti-inflammatory support, creating an epigenetic change on the DNA to change the expression of various genes. So that's good in quotes, unless you can't deal with the oxidation, unless you don't have the capacity to actually neutralize that oxidative load with antioxidant capacity in your body already.
I'm Garrett Salpeter, and I believe that the most powerful and transformative way to help people recover from pain and injury, heal from trauma, and reach their highest levels of fitness and performance is to focus on the nervous system. In this podcast, we'll share knowledge from the frontiers of neuroscience and inspirational stories of how applying that knowledge has empowered people from all walks of life to heal, adapt, and grow. Hello, NeuFit Nation, and welcome back to the Undercurrent podcast. I'm joined today by Dr. Scott Sherr, who is an internationally regarded MD, who's particularly known for his expertise in hyperbaric medicine. So that's one of the topics we'll talk about today. But as you'll hear, he also is the co-founder of a company called Troscriptions, which has some very interesting, targeted, just a few supplement products, including methylene blue, which I imagine we'll talk about. And he's also involved in this fascinating medical education nonprofit called Health Optimization Medicine, where they train other providers in really fascinating areas like metabolomics, epigenetics, bioenergetics, chronobiology. So he's got he's a wealth of knowledge. I've gotten to have a few conversations with him and just been so impressed. And I'm really excited to have him on this show so that he can share with you, as a provider, all these different things that you can use to, either your patients will be asking about them, and it's good for you to be able to know about them and have intelligent conversations. And there are also different techniques that you may want to leverage that will complement the work you're doing with the Neubie or the work you're doing in physical therapy and physical medicine, especially with more complicated patients like CRPS patients or patients who are recovering from brain injuries, things like that, where leveraging some of these other avenues can just really be helpful, really be an accelerator and work very well with the NeuFit methodology that we already talk about on here and that you're already familiar with and all that. So Scott, welcome.
It's great to be here, Garrett. Thanks for having me.
Yes. So as you already know, and as people listening can tell from my introduction, you're involved in a diverse array of different fields within medicine and different topics. Is there any sort of common thread,
the through line,
tying your work together there?
Yeah, that's a good way to start, I think, because in the end, I'm a clinician, right, Garrett? So I'm an internal medicine physician. I've been out of residency and been in the world of conventional and alternative medicine now for 15 years this year, actually. So I graduated my residency in 2010 as an internal medicine resident at the University of Maryland in Baltimore. And I spent medical school there, residency there as well. And so the through line for me is that I'm a clinician. What I've always been trying to do since I left residency and started my own practice, and for many years I worked in the hospital as well as a hospitalist, which is kind of an inpatient doctor for general medicine, basically overall. And so but I've always gravitated more to like an integrative approach, of course, and I've gravitated outside the hospital for my clinical practice. But the through line for everything is that I've always been looking for foundational ways to help people, and then from a foundation, build them up from there. And so initially my first area of expertise, and still is hyperbaric medicine. And I've been involved in hyperbaric medicine for over a decade. And it was kind of my first way of getting myself out of the hospital. Like when you first graduate your residency and you start, your practice, you have loans and things like that. And I had a couple children already at that point. And so for me, it was, I got to start making money, right? So the easiest way to do that as a physician is just to work in the hospital. And so it's what I did. But slowly over the years, I've built my hyperbaric practice. And initially it was just about hyperbaric medicine, just getting people into a chamber. But I realized very quickly that wasn't going to cut it, because so many people wouldn't benefit and don't benefit from just going into hyperbaric chamber. They need more of a holistic approach of how to think about what's best for them and how optimal they can be before they go into the chamber if there's time. And so I created an integrative practice where I started bringing other tools and technologies, other practices. And I like to call myself like a conductor of all things health optimization. But it really wasn't until 2017 when I met a fantastically smart physician named Dr. Ted Atracoso, where a foundation to that hyperbaric practice really became a part of what I do. And he is the founder and pioneer of something called health optimization medicine in practice, or Home Hope for short. And what Home Hope really is it's a framework that Dr. Ted developed in his own clinical practice. And he was able to bring to the US as a nonprofit and as a training program. So a 7-module training program for practitioners like me and like others, even if you didn't have a license. But the key and the difference for this, Garrett, was that it wasn't focused on trying to treat disease or even like approaching symptoms directly. It was, how can we optimize foundational health and shift the conversation from disease into illness? And this may be something that people have heard of before and it sounds familiar, but I promise you it's different, because functional medicine, which is fantastic, and I have a lot of friends that are functional medicine practitioners, their job is to find the root cause of your illness, right? And that's great, because it's much better than a conventional trained doctor, which would just be giving you a medication, maybe some dietary advice if you're lucky, in their 15 minutes that they can spend with you. But functional medicine is doing the root cause of that, which is great, but they're looking for the root causes of your illnesses, right? And that's not what we do at health optimization medicine and practice or Home Hope. What we're looking to do is look for the root causes of your health and trying to optimize your health and optimize your cellular function, your gut, your neurotransmitters, your hormones, your cellular optimization strategy. Organs are cool. We all need them, right? But every organ has a cell. All cells are basically the same and how they run. And it's really important for us to optimize that. And nobody's taking care of the basic cell. And when I spoke to Dr. Ted about this in 2017, it was like a light bulb went off in my brain or wherever else, because I grew up the son of a chiropractor, very out of the box. There's no like conventional medicine. I didn't know anything about it until I went to medical school, really. But it felt very aligned in that, because the idea was that you can give the body what it needs to heal itself on some level, but also to optimize itself. And so the foundation of my clinical practice is called health optimization medicine. And then I specialize, if you want to call it, on top of that with the hyperbaric work that I do. And so over the last now 15 years, I see people virtually in a consulting way for hyperbaric medicine. And also I work with clinics all over the world that are integrating hyperbaric medicine into their clinical practice or into their biohacking space or whatever it might be, or health spa, or you name the kind of facility. But I also work with people over the long term in optimizing their health over the long term, which takes a long time. And that's the other thing, is that when you're optimizing health with people, it doesn't happen immediately. It doesn't happen overnight. It takes months or years sometimes. And so the clinical practice, the nonprofit, out of that came something called Transcriptions, which you mentioned earlier. And Transcriptions is a company that helps you right now while you're on the longer path to optimizing your health. And it does it with various products that we develop to help you with energy, with focus, with sleep, with your immune system, with anxiety and stress, and with more. And so you help right now while you're on that longer path. And that's the ecosystem that I live in now. My clinical practice is kind of a dance between health optimization medicine, hyperbaric medicine. I use a lot of Transcriptions products. I use a lot of their tools, techniques, modalities. I refer out like crazy. And yeah, that about sums it up in 5 minutes or more. Sorry.
That's great. There is a through line there of the fundamentals of promoting good, vibrant health at the cellular level. So I like that.
Yeah.
As you were talking, I was also interested in just kind of wondering about the story behind the story, or the story behind the man here, of wondering if you were more traditionally minded and sort of went on this path. But then you mentioned you had that, I didn't realize your father was, had been practicing as a chiropractor. So you sort of had a little bit of a leaning, a predilection towards more alternative health. So what was your
leaning is, I think a leaning is a mild way to say it overall. I think Garrett, you know, a couple chiropractors, and my father's still practicing. His name's Dr. Alan Sherr. He's at the Northport Wellness Center in New York on Long Island. He's been in practice for 45 years. Last he checked, I think he'd done like around 3 million adjustments or something ridiculous like that. Like
Wow.
he's a machine, and he uses a lot of modalities, a lot of other tools and technologies. I'm not sure if he uses NeuFit actually, but he should. I should talk to you about that. But anyway, I grew up in his practice. I grew up in the coloring in his front desk when I was young, and then I grew up when I was in high school. I would collect money at the front desk, and I didn't let people leave until they paid him because I knew that was my money for college and my spending money for the week with my friends. And so, but the framework was always one where medications, acute care, conventional medicine had its place, but it wasn't usually necessary. And if you could work on the system in a foundational way, and he did this through diet, through exercise, through obviously chiropractic, but back in the 80s, I saw him taking people off of dairy, for example, and which was unheard of at the time, and actually encouraging women to breastfeed, which wasn't the thing that women did at that time either. And so, I mean, for example, I remember a number of stories of people with asthma, allergies, chronic infections, ear infections, and things like that, stopping dairy, and those would go away. And so I knew from a young age that you could do a lot with diet. You could do a lot with counseling in an optimal way and foundational kind of health perspective overall. And so my evolution to now, 45 years later, now that I'm almost 45, is that it's more focused on that is the base of what I do. And it's a very significant base, but it's over that, on top of that, I've built a lot of layers of understanding, biochemistry and physiology and understanding how to conduct all these kinds of modalities and talk out of both sides of my mouth. I can talk to like a radiation oncologist. I can talk to your energy healer. I can do everything in between now. So that's kind of what I try to be able to do and how I can help my patients most, I think, effectively.
I love that. East meets West, all in one
Sure.
man.
We can talk Buddhist philosophy, psychedelics. We can talk about energy healers, homeopathic. I can talk about the most advanced surgeons in the world doing micro, nano, blah, blah, whatever. And so like, it's a cool place to be, but I think there's a great, what was it, Aziz Ansari, like the master of none kind of thing, right? So I have a lot of people that I work with that, that I leverage, to help with their areas of expertise. I don't pretend to be an expert in all this stuff. That's for sure.
That's awesome. Well, you are certainly an expert in hyperbaric, and you've done a very deep dive there, and I'd like to learn more about that. But before we do that, one quick question. Since you talked about the health optimization medicine, the home nonprofit, and there's a lot in there about longevity and aging, long-term health. I just want to ask a little bit of a tangent here, but what are your thoughts on these like True Age or these epigenetic tests for rate of aging? How good are they now? How meaningful are they? What can you learn from them?
Can I use a 4-letter word?
Sure.
Interesting. Not a 4-letter word, but they're all very interesting in the sense that they give data, but how you can use this data over the long term is still not quite clear. A lot of these tests can be gamed overall. So like, for example, I have a friend of mine, her name is Dr. Lucia Aronica. She's a professor, assistant professor or something at Stanford. She does a lot of research, for example, and a lot of research on epigenetics specifically, which is the study of how our genes expression changes depending on environmental and other kinds of stimuli overall. And she's saying, like, for the epigenetic test, for example, you can go vegan for 6 months. Your epigenetic age will get better, will decline. So meaning that you'll get younger. But while you got vegan, especially if while you went vegan, while you went vegan for 6 months and say you're 60 years old doing this, you've lost 20% of your lean body mass. Like, so is that really healthy? So if you may live longer decrepit, for example, but if you have a fall in a month and you have 20% less lean body mass and you're sarcopenic, you have a high risk of having a hip fracture. And then if you have a hip fracture when you're over, I think 65 or 70, your risk of dying in the next year after you have hip fracture is like 15% or something ridiculous. And so I think many of your colleagues and practitioners probably know that from people that have had hip replacements. It's it's a legit thing, especially if you have a traumatic fracture. So my overall gestalt with all of this is that they can be used, but they have to be used in the setting of understanding that we're still in the early stages of this. I mean, there are newer tests that are coming out, like that I think are more interesting on some level, like the ages of your organs, not maybe your earlobes or some ridiculous shit that I've seen recently with Brian Johnson. I mean, he takes things, he does he does a lot of it for show, like your earlobe or whatever. But I do think that the newer clocks that are coming out to look at this are going to be better, and hopefully not be able to be as gamed in the system. There's another one I was looking at, which is proteomics, which is interesting. So the proteins that get transcribed from the DNA, that I think, again, what I would say here, Garrett, is a big conversation, but when you're looking at various sciences now that are looking at trying to give you a prediction of how long you're going to live, or not only how long, but how healthy you're going to live too. And that's the key for health optimization medicine, is not so much longevity as much as it is health span. The idea that we're trying to give you as many good years as possible for as long as possible. But the challenge is, as I think is that we are living longer overall, but the amount of years that we're living that are healthy and that are vibrant is still going down overall. And then you're getting people that are sicker and sicker and sicker. And so the idea with health optimization medicine is to optimize health span overall, looking at various different types of sciences, things like epigenetics and metabolomics. But you have all these sciences that are kind of built from the DNA out. So DNA obviously is your genome, right? We know that for sure. Like genomics, your genes, they don't change still. I mean, they're doing gene therapies, but like for the most part, genes don't change unless you get like a myostatin gene thing or whatever. You're trying to do something crazy. Like that's still very early on. And I don't recommend that at this point. But so you have your genome that doesn't change. It gives you risks for certain things, but you don't know. Like genes aren't your destiny. Even if you have like 2 alleles of the ApoE gene for Alzheimer's, it's still giving you like a 60% chance of getting Alzheimer's. It doesn't mean you're gonna get like 100% chance, right? Your BRCA1 gene, which is for breast cancer, like that one will give you like a 60 or 70% chance of breast cancer, but it's not 100%, right? So your genes aren't your destiny, okay? From your genes, you have your genome, and you have your transcriptome, then you have your proteome, and you have your metabolome, okay? These are all various levels that come off your DNA, okay? And so at some point soon, because the paper was written like 10 years ago, you're going to have something called the narcissome, like narcissistic, like everything about you. You're going to have like, basically you take a blood test once a year or whatever it might be, maybe once every 6 months, that gives you all the data from all these levels that are coming off the DNA. And then you can crunch all this data. And with AI, this is going to become a lot easier. And then go, okay, in the next 6 months, you got to worry about X, Y, Z. In the next 10 years, you've got to think about, this or whatever. So that's all happening, right? That's going to happen soon. But the most actionable of all that right now is something called metabolomics, which is the study of how our cells work in real time. And if you're looking at cells in operation in real time, what you really care about are what the inputs in those cells that are making them healthy or unhealthy, and what's in the cell itself, and then what's coming out of the cell, right? And so in health optimization medicine, we look at what are called exogenous and endogenous metabolites that are in the cells that are working in real time to either help you make energy effectively or not, really is what it comes down to. Because in the end, what does it come down to is either making energy effectively or we don't. And that's all about mitochondrial function. So I don't even remember the first question that you asked me. I've gotten pretty far off here. So bring me back. Where do you want to go here, Gary?
We were talking about aging clocks, those tests, and then so you got into other tests. So it's a natural segue. And metabolomics, I mean, if you mentioned this through line among these different areas of your interests, that we're talking about fundamental health, and you mentioned cellular health, and it seems like it if you're looking at a fundamental level, it's ultimately energy. Each cell has to have enough energy to get rid of its toxins, to perform its metabolic processes, and that also is relevant for the autonomic nervous system. If there's not enough energy being made, that's one of the reasons why one would activate the sympathetic nervous system to mobilize energy to meet a short-term deficit and stuff. So it's relevant for so many things. So if I sort of think about the energy levels without caffeine and with legit underlying bona fide energy levels as sort of one of the best indicators of health. Do you think that's a fair statement?
Yeah, and it's also my through line into the sense of how I got very interested in a number of different things. But what it comes down to is that energy metabolism, the way we make energy, is so important, and it deteriorates as we get older. The enzymes that are involved get slower, they get more sluggish. The ability for our body to detoxify gets worse as we get older as well, and so we get a building of rust in the system. So our mitochondria are our energy producer. We have many of these in our body, and for me, the through line there is on the hyperbaric side, right? Because, and we can talk about it, but hyperbaric therapy floods the body with a significant amount more oxygen. And what happens with all that oxygen is the big question. You're trying to make energy with that oxygen, for sure. But not only do you make energy, but you also make waste products of energy metabolism overall. Meaning that you create oxidative stress, you create reactive oxygen species, free radicals, as a result of a flood of oxygen. But even on a regular basis, you and I right now, we're making energy all the time. And we are also making the waste products of energy metabolism. Some of those, I mean, waste is kind of I think a crappy word to use another crappy word with waste. But anyway, it's a shitty word. Okay, let's use all of them. But because it's not really a waste product. You have the things about the products that are made from the mitochondria include, obviously ATP. ATP is our energy currency. We make about 165 pounds of ATP every single day. So it's a huge amount of ATP. It doesn't stick around for very long. We make a lot of it. We also make carbon dioxide, we make water, when we make energy, and we also make, these free radicals, these oxidative molecules. And so the problem though, Garrett, and you kind of alluded to this, is that many people complain of having a difficult time making energy or feeling like they're energetic. And oftentimes this is because the mitochondria aren't working very well. And this is not surprising, given that 94% of the US adults have some element of mitochondrial dysfunction overall. And so it's a huge number of people overall that have mitochondrial dysfunction. And, in medical school, actually not in medical school, sorry, in 7th grade, let's go back to 7th grade for everybody, right? When you learned about the cell, you learned that the cell had a nucleus, cytoplasm, a cell membrane, Golgi body. I always like the Golgi apparatus. It's kind of my favorite. Also, there's a Fish song named Golgi apparatus, which is great. That's making me feel old, but some of you probably know that song. And there's also the mitochondria. And in the picture, you saw one mitochondria in the cell. Okay, but that's not how it rolls. There are some cells in our body that have thousands of mitochondria, and there are some cells in our body that actually have 0 mitochondria, or just a couple. So the one cell in our body that has 0 mitochondria, the red blood cell. Red blood cells initially have mitochondria, but then they get rid of their mitochondria so they can carry more oxygen instead. That's what red blood cells do. The most mitochondria per cell, do you know this? I don't know if this is a good question. This is a good trivia, Garrett, but I'll give you the first one because nobody ever knows this one. The most mitochondria per cell is actually in eggs and sperm, which makes sense. Next is, any ideas?
I'm going to guess heart or brain.
Both, yes, the brain and then the heart, liver, and musculoskeletal tissue, right? Your musculoskeletal tissue has a huge amount of mitochondria in reserve, so that if you need to run from an animal that's trying to eat you, that you can run faster than you've ever run before because you have that capacity potentially. But the problem is that 94% of US adults have some element of mitochondrial dysfunction. Why? Because of infections, because of stress and inflammation and toxins in our environment, because of insulin resistance, because people are, their poor diets overall. Medications will do this. And so as a result, insulin resistance actually is the number one reason why people have mitochondrial and metabolic dysfunction. And so the key there is understand that so many people are having a hard time with their mitochondria overall. And if we can optimize the inputs, optimize the creation of energy and the detoxification, people can feel so much better overall. But this is actually where I got in trouble initially in hyperbaric therapy. And I didn't realize it. When I would put people into the chamber that weren't ready for this huge flood of oxygen that was going into the system, creating energy, yes, but also creating oxidative stress. And hyperbaric therapy works in multiple ways, but one of the major ways it works, Garrett, is by creating oxidative stress. And that oxidative stress then causes a shift in what's happening underneath in your body, including stem cell release, anti-inflammatory, anti-inflammatory support, creating an epigenetic change on the DNA to change the expression of various genes. So that's good in quotes, unless you can't deal with the oxidation, unless you don't have the capacity to actually neutralize that oxidative load with antioxidant capacity in your body already. And that's where I got in trouble. And that's my through line into health optimization medicine, because I was like, well, I need to help these people because they're not getting better, or they're getting worse in the chamber even. This is because they can't do the things that we just described. And so, yes, a long answer to your question is that this is, I guess, what I do for your podcast today is that, and I can go shorter, I can go like, but that's how my brain's working this morning. But in essence, what you're looking here is that, when you're looking to optimize mitochondrial function, you're looking at the inputs, you're looking at the outputs, and then you really need to be able to neutralize those outputs, especially. And that's how I got all involved in the world of health optimization medicine. And in the end, yes, if you have poor energy, if you don't have the amount of energy that you did when you were 20, it's not uncommon, but there are things you can do to get back there.
Awesome. And that, I think, is a good theme that we will touch on throughout this, energy as sort of the fundamental area to focus on. We need to have enough energy to keep the lights on, so to speak, to do the processes necessary for survival in order to have any left over for higher level cognitive function or for athletic performance or whatever it might be.
Exactly. Yeah.
In terms of, there's a couple interesting things that you said about hyperbaric that I want to touch on, but just to make sure that everyone listening to this is up to speed, Scott, can you explain just, overview on the mechanisms of the difference between blood oxygen or red blood cells and blood plasma and how you saturate?
Sure.
Sort of explain that mechanism so everyone's on the same page.
Yeah, totally. So the quick and dirty on hyperbaric medicine in 3 minutes or less, I'm going to try, is that it's a combination of increased inspired oxygen combined with increased atmospheric pressure. So oxygen, we all know, we've just alluded to it a little bit here, but oxygen, why do we need oxygen? Because it's the final electron acceptor in our mitochondria that allows us to make that ATP. Without oxygen, we can't make energy unless you have methylene blue around, which we can talk about later. Foreshadowing to later in the conversation. So, but oxygen's obviously really a big deal. So red blood cells typically carry oxygen in our body. If you are at sea level, which Garrett is, you are getting 21% oxygen in the air that you're breathing. I live in Colorado. I'm at 5,500 feet. The amount of oxygen in the air that I'm breathing is about 17 or 16%. Okay. And so the rest of the air that we're breathing is mostly nitrogen. Now, if you live in a city, especially in a developing city around the world, or like China, for example, you get a lot more other gases that you don't want, like your carbon monoxides and volatile gases and all that kind of crap. But in general, 21% oxygen. And the cool thing about that is that you can carry, if you put a pulse ox on your finger right now, you'll get if you have normal lungs, it'll typically measure somewhere between 96 to 100%. And that means that these red blood cells that are carrying oxygen are almost fully saturated with oxygen at sea level for Garrett, or at 5,500 feet for me. And I'll talk about why for me in a minute, because oxygen carrying capacity is relegated to how many red blood cells that you have. So red blood cells carry oxygen. Every red blood cell carries actually 1 billion oxygen molecules. Fun fact. So it's a lot of oxygen that we carry already, and our pulse ox reflects that. We have 95 to 100%. So our lungs are very efficient at getting that oxygen out of the ear, even 21% or 15% in my, or 16% in my case, and carrying it to the rest of the body. And that's typically how we dump oxygen into tissues. So the only way, really that we can do an easy increase in oxygen carrying capacity is by increasing the number of red blood cells in circulation. Typically, this is when you come to altitude, like you come to Colorado, you live up here for a little while, you get a hormone that gets secreted called epigen, or EPO for short. And if you've heard of like Lance Armstrong and other people using the doping drug is called epigen because you can take it exogenously and it can increase the number of red blood cells you have in circulation. You can also just give yourself a transfusion of blood, right? You can also do that because that's going to give you more oxygen carrying capacity. So, but there's another way to increase the amount of oxygen in circulation, and that is by driving more oxygen into the plasma, or the liquid of the bloodstream. That has very little oxygen in it at sea level, but by increasing atmospheric pressure and using a physics law called Henry's law, which states basically that the more pressure you put on a gas, the more of that gas is going to go into liquid form. You get more of that oxygen going into the liquid of your bloodstream, the plasma. And with hyperbaric therapy, we can drive up to about 1,200% more oxygen in circulation. Now, not a lot's going to go in those red blood cells like we just discussed, because most of those sites on the red blood cells are already being taken up just at sea level, but it's going to drive it into that plasma. And that's the power of hyperbaric therapy, is that flood of oxygen in the body. And then basically 3 things are going to happen as a result of that. You're going to get more oxygen in the body, obviously. You're going to get more oxidative stress that results from that oxygen, and that's important too, that we just mentioned. And the third thing is there's pressure related changes that are happening. As a result of those 3 things, you have decreased inflammation. You have new blood vessels that are going to come out. You're reversing low oxygen states. You're going to get stem cells released. It's an anti-infective. It works on the immune system. It improves blood flow and lymphatic flow for detoxification and more. But that's it in a short. Here you go.
So the two benefits, I mean, there's also this mechanical benefit of pressure. Let's leave that aside for a moment. There's benefits related to increasing oxygen, which presumably helps, get oxygen there to be the electron acceptor to help with energy production. And then there's what you mentioned of oxidative stress, and it's, essentially a version of hormesis, which,
yes,
if you listen to this, you likely are familiar with hormesis. It's the idea of exercise. We actually, we breathe heavy. We break down our bodies and energy supplies, deplete ourselves temporarily so that we come back stronger, better to able to meet that challenge next time. So hormesis is also going into cold water or a sauna, temporarily disrupting the body so that it becomes better at self-regulating, becomes more resilient. So it sounds like a version of that. One, I'd like to hear more about how that works. And then two, is it possible to parse out of these benefits you talked about on inflammation and stem cell? Is it possible to parse out what benefits are due to increasing oxygen versus which are due to this kind of hormetic-like effect from oxidative stress?
Yeah, that's a great question that nobody's ever asked me before, because it's a technical one in the sense that piercing it out or piecing it out, is whatever the word is actually quite simple overall. So increased oxygen delivery is going to be very, very important to reversing low oxygen states overall. So the actual energy production aspect of things and getting more oxygen to the tissue can save tissue. So there's been studies on acute traumatic brain injury, acute heart attack, stroke, spinal cord injury, and others, or traumatic injury to a limb. You can save tissue if you can get somebody into a hyperbaric chamber as fast as possible, as safely as possible. And there are studies on all of these things that I just mentioned. All right. And so the major benefit of getting the oxygen in there only sort of by itself is that because you can reverse low oxygen states. Okay. And that's really the most important aspect of that. When it comes to oxidative stress and hormetic stress, that is the most important piece here by far, because what the hormetic stress is going to do is it's going to start initiating a various sequence of events. It's going to start these epigenetic changes that are going to start happening. That some start happening very quickly. Some happen over the long term, over more hyperbaric sessions. But some happen. So the stem cell release is related to hormetic stress. The anti-inflammatory aspect of things is related to hormetic stress. There is a vasoconstriction aspect of things that can happen, and that's actually related more to oxygen. What oxygen actually does is binds up free nitric oxide that's in the bloodstream, and then also it causes a mild vasoconstriction. So that's more related to the oxygen delivery. But in essence, oxygen or oxidative stress causes the stem cell releases, causes the inflammatory changes, immune system optimization. That's the anti-infective aspect of it, and it's the epigenetic aspect of it. So that's mostly what's going on. And then the pressure-related changes are kind of both. Pressure-related changes are more, they increase energy production on their own, and they also increase hormetic stress and oxidative stress as well. So in the end, most of what's going on is related to oxidative load.
Thank you so much for listening to the Undercurrent podcast. If you're interested in learning more about how NeuFit and the Neubie can impact your life, please visit our website at www.neu.fit, that's neu.fit, so you can learn more about how it might integrate into your professional practice, how you can use it as a patient, and you can also connect with our team there. So how much overlap is there in the benefits of hyperbaric and the benefits of exercise?
So that's a good question. Yeah. It's different because the oxidative load is in a different location, right? Mm-hmm. And so the benefits of exercise are going to be oxidative load in the muscles, right? And causing free radicals in the muscles. Whereas in hyperbaric chamber, you're causing it more systemically and more in the mitochondria itself. And so as a result of that, it's a much more of a systemic therapy than exercise in the respect of, musculoskeletal tissue is going to get the most benefit of exercise compared to, other areas are going to get more benefit, as a result of being in a hyperbaric chamber in general. But also the types of oxygen radicals that are being formed are a little bit different as well. But in essence, they're very synergistic is what it comes down to. So it's almost like instead of,
going sprinting with your musculoskeletal system. You're going sprinting with your liver and your kidneys and your
exactly. Yeah. And your bone marrow, right? And your bone marrow, right? So like, because what your bone marrow is going to do when it gets stressed is going to release more stem cells, right? And we know exercise does this to some degree as well, right? It's going to release more stem cells, it's going to do that whole thing. But you could think of like, it's sort of like supercharged in that case. It's like what exercise can do, hyperbaric therapy does dramatically from like a more cellular perspective, as where exercise is focused more on musculoskeletal tissue and rebuilding and remodeling. So it's sort of balanced. Sort of muscle systemic is exercise versus like systemic muscle is the other is more on the hyperbaric side. It's a good question.
So one related question before we get into clinical applications of hyperbaric. I've heard, and I may be hearing this wrong, or I may have been told wrong. So you just tell me if this is wrong. I've heard that people are into these hydrogen water, and I've tried one of these things that I go in and sort of put in a tablet into my water, it effervesces like an Alka-Seltzer, or people have these generators that put hydrogen gas in there. And I've heard it explained to me that hydrogen gas works in a similar way, where it is essentially a type of oxidative stress that triggers the body's inherent antioxidant mechanisms to begin to work. And it's also a similar type of hormetic effect. Is that true? Is it wrong? Does that stuff work? Is it bullshit? I mean, what are your thoughts on that?
I don't know a lot about hydrogen water. Or hydrogen itself. Obviously, is the gas. I know the on the periodic table where it is as well. But my sense, from what I understand, is that what people think hydrogen water or hydrogen's doing when you take it in water or gas is it's something called the redox cycler, where it has the capacity to help you make energy and also detox at the same time. So it doesn't cause a lot of stress on its own, because it has the capacity to kind of cycle back, both with being something that donates electrons or not donate, it doesn't donate electrons exactly, but it's more like provide energy to the system or provide detoxification to the system at the same time. So I've used not a lot of it, but some hydrogen in patients that are sicker overall, to help them tolerate being at deeper pressures in the hyperbaric chamber over the years, with some success overall. So I think there is something to it. And there's a whole hydrogen society and everything else that's around hydrogen itself. So I think it could be synergistic with hyperbaric therapy, but I also don't typically like to use a lot of other things that are going to block oxidation around hyperbaric therapy for longer protocols, at least, because the idea is that you want the oxidation to happen so that you can create the oxidative stress and the epigenetic response and everything else that goes along with that. The other thing that's different from exercise is that there's about 8,000 genes specifically that are oxygen sensitive overall. And so increasing oxygen in the system has an effect on 8,000 genes specifically related to oxygen. And those are related to inflammation, angiogenesis of new blood vessels, programmed cell death, and things like that as well. So this is a more of like a nuanced aspect of what I would discuss with my clients and people that are looking to do hyperbaric therapy when it comes to like, what do you do with antioxidants around hyperbaric therapy, for example? In essence, you don't want them for the most part if it's going to be a longer protocol, because you're looking for that hormetic stress and that epigenetic change. But if it's like one-off hyperbaric therapy session, it may be something you want to do because you don't really care about the oxidation as much as the oxygen delivery. And a good example for that is a simple one like jet lag, right? If you're getting off an airplane and you just were hypoxic on a plane, pressurized 8,000 feet, which is what you are on a plane, you don't necessarily need oxidative stress or hormetic load there. You just need some extra oxygen to rebuild and replenish what you just didn't have for however many hours when you're on an airplane, right? So in that case, take as many antioxidants as you typically would. And then at the same time, using hyperbaric therapy can be very effective. So again, more of a nuanced conversation, but I think you get where I'm going.
Yeah, it's a great point to understand, this is a powerful tool, when and where it should be applied. And that's a great point on the use of antioxidants afterwards, how it can block some of the effects. And the same is true after exercise. There's some
Absolutely.
great literature showing that, as we've just been discussing, a part of how exercise works to create adaptations during the subsequent recovery period is because of oxidative stress. And so if one takes significant antioxidants after exercise, it can actually block some of those adaptations.
Yeah, just like going to a cold tub right afterwards too. But at the same time, what is your goal? And that's the main thing with hyperbaric therapy. Is your goal from like a performance perspective, like in the sense that what I've done in the past is have somebody do 30 minutes in a hyperbaric chamber, jump into a cold tub or do some cryo, and then, have a fantastic, amazing day. That's not because I cared about their hormetic stress. I just cared to getting more oxygen in the system, give them more energy, and then then go kind of deal.
And then so you could get them more oxygen, and then you could quell the adverse effects, the short-term adverse effects of the oxidative stress, so you can get the best of both worlds.
Yeah, and then it also depends on how deep you go into the chamber. There's different types of chambers. There's mild units that go to mild pressures, deeper pressure units that go to deeper pressures, obviously. And the deeper you go, the more oxidative load that you're going to create. And again, that could be a good thing depending on the situation. The brain is more sensitive to oxidative load overall than the rest of the body. And so typically you need less pressure, less oxygen to see a benefit for the brain compared to the rest of the body. But in essence, for people that are using it more for like day-to-day operations, for recovery, or even performance, like you're not typically going to as deep of a pressure because you're already under significant amounts of oxidative load, especially if you're doing like too much exercise, right? So you don't want to go too deep because it actually can make you feel worse. And a good example of this is our buddy, not everybody's buddy, but like the tennis player Djokovic. Everybody's heard of Djokovic, right? He's one of the best tennis players of all time. He travels with hyperbaric therapy. He travels with either he travels with an actual unit himself, like a hard shell unit, or he goes to facilities around the country or around the world when he's in his matches. But he will, like, for example, when he's in a match, he's not going to go to a very deep pressure in the chamber. He's just going to a mild pressure, 1.3 to 1.8 atmospheres, just to get the oxygenation piece of it. And then he's doing all his mitigation strategies from an antioxidant, oxidative load perspective too. So like in our athletes, we have to be careful of that, right? Especially if they're overtraining. And this is something that I learned actually a long time ago from a colleague in Australia, actually, how to do this.
And it's just like, we often talk about, you have to balance, whenever we're doing any training or rehabilitation stimulus or input, too little, just sitting around on the couch being sedentary isn't going to stimulate what we want, but too much is problematic too. We want just the right amount. And so here it's balancing both that input of oxygen and the oxidative stress. So
always,
optimizing that.
And that takes testing, Garrett, is what it comes down to. So the whole thing full circle for me is that the way you do that is you actually look under the hood and what's happening in the cells. And then you can give people what they need to help support their antioxidant capacity, support their energy production. And so whenever I'm thinking about somebody going into a hyperbaric chamber, my framework is, what are you doing before, during, and after to optimize and to optimize your hyperbaric experience? Or you can look at it in the reverse, like how you're using hyperbaric therapy to optimize whatever else you want to do. But in essence, like the beforehand is like, do you have the energy machinery? Do you have the machinery capacity to make energy effectively? And do you have the machinery and the capacity to detox from the energy that we're going to be making for you? Because if you don't, it's not going to feel good, like I promise. And people have done like deeper pressure hyperbaric therapy and felt like shit afterwards. It's because their system is not prepared for all that oxidation. Now, there's ways to mitigate that, and there's ways then some people do have a little bit of pain before they have gain as they're rebuilding the system, but you can support them through that. The best thing to do, though, is to test, and that's what the health optimization framework has allowed me to do. And so, fun story is that in about 2021 or so, I was invited to speak at a hyperbaric conference virtually. And the title of my talk was going to be, "Please do not put them in a chamber." And I got disinvited from speaking when that was my title. But the goal for me to say there, and it's still important, and I don't really care about that in the sense, but it's a good story, is that my framework always is hyperbaric therapy is likely going to be an effective tool for almost everybody. It's not if, but it's when. And the when is key. If it's an acute issue, just happened, hyperbaric therapy can be fantastic for a lot of the reasons we discussed already. But if there's a chronic issue, if it's been going on for a long period of time, 3 months, 6 months, 30 years, I can promise you that hyperbaric therapy is not the first thing you should be doing when you're trying to get better. Okay. And it might be the 10th thing or the 20th. And so a lot of the conversations I have with patients over the years, now less so because they've listened to my podcast and they know what I'm going to say, I think, but in the beginning, it's like, okay, you want to do hyperbaric therapy for migraines. Okay, let's talk about 80% of this conversation is going to be nothing about hyperbaric therapy at all. And then at the end, we'll talk a little bit about how hyperbaric therapy would help after, considering some other options or things to do first. So waiting to go in the chamber 3 to 6 months sometimes is a very common recommendation that I give, and not always taken in the right way initially for people. It was like they just want to get into a chamber and feel better. But when I give the explanation as to why, most people are on board.
That makes a lot of sense. And you started touching on a little bit of what I wanted to ask about next, which is some of the clinical applications. You touched on this notion of, well, I'll frame it up here, a little more context. So many of the people listening to this are physical therapists, chiropractors, athletic trainers. They're working with patients. There's a category of patients, sports medicine athletes or general population. Then there's another category of neurological patients. And I'd like to talk about how hyperbaric can help, it can complement the treatments that we're already doing, in both of those categories. I have seen it more in this neurological realm for patients who have traumatic brain injury or
For sure.
concussion,
Yeah.
MS, neuropathy, stroke, CRPS, or fibromyalgia, or some of these more chronic conditions that have an element of chronic pain. And you already mentioned, so I'm just reviewing here, that the biggest benefit to increased oxygen delivery is acute. So that's not going to apply here. Many of us are working with someone who has had a brain injury months or years ago, or has been diagnosed with MS for several years, and now they're trying to restore function. So we're not really able to address the acute thing anymore. So you mentioned hyperbaric, probably not even the first thing you're going to do with them. So,
right.
But how would we think about using hyperbaric to complement, for example, NeuFit treatments to try to help someone with one of these conditions restore function and increase that rate of neuromuscular reeducation?
It's a great question. I worked with a lot of patients over the years with chronic conditions and brain injuries, stroke, CRPS, or reflex sympathetic dystrophy, so systemic, neurologic, and all these things fall into the same category that I mentioned earlier, which is like these really are chronic conditions that really do benefit from an optimized health or an approach that foundationally looks at biomarkers, especially for energy metabolism. How well they're making energy, how well they're detoxing. Because if you don't do those things and you try to get them in the chamber, I just don't have the experience over these last decade that people do as well as if you just take the time and do some of that work ahead of time, if you can, if it's possible, if these patients can overall. And something that I use a lot in this world to get people started is methylene blue, which we can talk about later, but it's a fantastic mitochondrial optimizer. It helps with the energy and detox side of things. We have good studies that show that hyperbaric therapy can be fantastic for the brain, for example. And one of the ways that we can see this is the way the metaphor or the picture or the image that I typically like to give is if you can imagine throwing a rock into a still lake, and that still lake has an impact of that rock, and then you have the ripples around it. So if you've had a stroke, for example, that impact is where the stroke happens. That's where the tissue's dead, but the ripples are where the tissue's been damaged or dysfunctional, but not completely dead, and may have the potential to come back and to survive. And so that's where hyperbaric therapy can work and can actually help with rebuilding that tissue over time. And it's not because of the oxygen delivery per se, although the oxygen has to get there. It's the oxygen free radicals. It's the oxidative stress that's happening as a result of that oxygen delivery that allows the epigenetic changes to happen. So you have new blood vessels, you have decreased inflammation, you have the harnessing of stem cells to make new tissue in the area, new connective tissue, new neurons, new supportive glial cells and things like that that can be rebuilt and remade. And so we know this is what hyperbaric therapy does very, very well. And you can look at imaging pre-post stroke with patients that have done hyperbaric therapy, pre-post concussion, and others, and you can see the benefit. And there's also a couple studies that were done on older people, like in their 60s, looking at it was a longevity study that showed even like healthy aging overall, you can reverse the aging markers in the brain. You can revascularize the brain. You can revascularize the heart. You can increase VO2 max as well. And this has been actually shown not only in people that are over 60, but also in athletes as well, remodeling the left ventricular ejection, left ventricle in a way to improve stroke volume overall. There's also increased in vascularization around the genital region. So they've actually shown improvements in things like erections, for example, and sort of like your oxygen-induced Viagra kind of thing in people that are 60 years old or above. So in essence, the physiology doesn't change. It's just a condition that's sort of on top of that, where hyperbaric therapy is obviously being implemented. The key is also just, again, making sure you understand that the best way to do this is usually to optimize the system as much as you can ahead of time with laboratory testing, with vitamins, minerals, nutrients, and cofactors, with diet, with lifestyle, as much as you absolutely can. You can't always do all of this stuff. Sometimes you can just do some of it, but anything you can do is going to be better. So even people that don't do laboratory testing for me and can't get to a facility to do stuff, I'm still going to be putting them on like some basic energy support, some basic detox support, just to make sure that like at least they have some support, because most people need it, is what it comes down to.
When you talked about the vascularization effect, I couldn't help but think of peripheral neuropathy. We just had this study that came out at the beginning of 2025 looking at how it was actually, just for your benefit, Scott, it was really cool because it was the first study in humans comparing head to head the effects of direct current versus alternating current. And part of what makes the Neubie unique, and I know you've had an experience with it that maybe we get to today, but part of what makes it unique is that it uses direct current and there's some sophisticated engineering behind it. And so we saw this just dramatically positive, much different, much more significant beneficial effect using direct current compared to alternating current, including increases in EMG amplitude, nerve conduction velocity in just 6 weeks. So we're inferring,
Amazing. Amazing.
improvements in literally, regeneration of nerve axons and remyelination and things like that. But a big part of the mechanism, especially with diabetic neuropathy, is the blood sugar dysregulation, damaging peripheral vasculature, reducing blood flow to nerves, and therefore they atrophy. So it sounds like there's just what you described there, in revascularizing the brain, likely the same things happening in the peripheral nerves. And this is a great complement for those types of treatments as well. Is that fair?
Fair. And I think the key here is to understand, and this is very, again, this is a very special point overall to how I think about these things, but you have to direct the body to what you want, right? And this is what you're doing with your technology, right? You're actually stimulating those nerves directly. And so what's going to happen is that the body's going to be like, oh, we need to go over there and do more stuff because you're stimulating this, and we need to do more to help, rebuild or reboot or whatever. And so when I'm thinking about combining hyperbaric therapy with other modalities, neurofeedback, brain training. Why? Because you're going to be bringing more blood to your brain to try to start working on those areas and optimizing or neuroplasticizing, whatever the word. I don't know why I'm making it into an ing sound. But anyway, but the same thing happens with your nerves, right? If you are trying to rebuild nerves, you are bringing a direct stimulus there, as you are with your technology. And hyperbaric therapy, again, is going to leverage where you're bringing all that blood flow, right? And all that attention. So wherever the attention needs to go, you need to use other modalities, in my estimation, to help leverage what all that oxygen is going to be able to do. So I think it would be cool to do, some sort of, paired combination while they're doing like the NeuFit or the Neubie. They're also getting hyperbaric therapy at the same time. I bet it would be massively synergistic.
We're going to be talking about that as soon as we stop this recording here.
Nice.
So I mentioned also this other category of patient, sports medicine, general, athletic. Athletic population or general population. It seems like the benefits there in terms of helping healing are going to be similar in terms of helping with vascularization, helping with, getting these changes in other areas of the body. Is there any more to touch on in terms of complement,
athletic performance is like a whole thing, right? There's obviously the recovery is the biggest overall, I would say, because most people are overtraining in general. So you can use hyperbaric therapy at the mild pressures overall, as I was alluding to earlier, as a recovery tool. Like I had a marathon runner that I was working with for a while. She was able to sleep 2 hours less every night because her recovery was so much better using just mild hyperbaric therapy in the evenings when she was training hard. We also used it for her when she had an Achilles tendon strain and she was supposed to be out for 6 weeks. She was back running in 2 weeks, right? So you can use it as a recovery just from day-to-day operations. You can also use it as recovery from injuries specifically. You can also use it as a boost overall, as a way to help with athletic performance. And this is a little bit more fun, kind of, because when you go into a hyperbaric chamber, we discussed that you get hyperoxygenated, right? And so all that extra oxygen stays in circulation for about 15 to 30 minutes after you leave the chamber. But you will find that most people that do endurance work or exercise in that 24-hour period post hyperbaric therapy will be able to do more for longer because their oxygen utilization capacity goes up as well for about 24 hours-ish as well, but especially over that first 15 to 30 minutes. And so one of my legal doping hacks is, I've pitched this to some cyclists, but nobody's done it as far as I know, maybe they have, is like bringing the soft chambers that are portable to a race, getting in the chamber for 45 minutes right before they're about to go, and then get right on and start doing their thing. It's practicality is hard because you have to warm up and everything like that, but it's a nice way to increase your oxygen carrying capacity legally.
Sounds like a good idea to me. One other, actually, I moved along prematurely from the neurological cohort here. Is there any thoughts on applications for patients with things like complex regional pain syndrome, fibromyalgia, stuff like that, which is a little different than healing brain injury or peripheral nerve degeneration? Just kind of a little bit of different thought there, but can you connect those dots for us?
I've seen a significant amount of benefit, but typically not just in thinking about hyperbaric therapy. It's more of a comprehensive understanding of what's going on cellularly and trying to shift their system into more one that can actually do what it's supposed to do. And that could be anything from parasympathetic activation to addressing viral illnesses to optimizing electron transport flow. I mean, there can be a number of different things overall. But in essence, the answer is yes, but in the sense that if you really want to see the long-term benefit, what I found is that if you go into the chamber with a long-term issue like fibromyalgia, chronic fatigue, chronic regional pain syndrome, you may see an initial benefit going into the chamber. But if you weren't really working on that underlying physiology that caused it, or at least it was responsible for it in some degree, maybe it's psychosocial physiology, right? Like trauma, stress, sympathetic activation, you likely won't see the benefit over the long term, which is what I try to avoid in patients these days is like, yeah, they'll feel better for a short little while here, but just go back to the way you were before is not my idea of a fun ride for anybody. So if we can avoid it.
Yes. Okay. Well said there. And one of the things that you have said several times is even when you're using hyperbaric and you have devoted a large segment of your career to this, that it's not the only thing. You have to make sure people are healthy first. And in that context, you've mentioned a few times methylene blue. So we did some foreshadowing there, but can you tell everybody what it is?
Yeah, I would say if not necessarily healthy, but supported, right? And I think that I don't necessarily think everybody that needs to be optimized perfectly when they go in a hyperbaric chamber because it's a process. It takes time. It takes years in some ways. And that's what
that's fair.
When we first started using methylene blue at Transcriptions, it was my way of helping people right now on the energy metabolism side, and still is, while they're doing the harder work over time of optimizing their system. But you could use a little bit of low dose methylene blue at the same time as putting them in a hyperbaric chamber. And the combination has been fantastic. And so it's a really awesome compound. It's been around a long time. It's been the first drug registered with the FDA back all the way in 1897. And it was synthesized in the 1870s as a textile dye and used to dye blue jeans blue. So it's got a pretty storied, interesting history. Initially, it was used mostly as an antimicrobial at high doses, over about like a milligram per kilogram or so. Now we know it's a fantastic mitochondrial optimizer. It works by enhancing energy and electron flow through the mitochondria, and it also helps as a detoxifier. And the cool thing about it is it can compensate for any area of mitochondrial dysfunction. We alluded to, I think alluding is my favorite word during this podcast, by the way, Garrett. We talked about mitochondrial dysfunction earlier. We talked about the reasons for it. Methylene blue can come in and kind of save the day no matter what the issue is overall. And it doesn't mean it's going to make things perfect, but it can help significantly. And it's still on the World Health Organization's list of essential medications, actually, because it does a couple of things. It can help oxygen be carried better on hemoglobin, which is kind of cool for my world too. And that it also is an antidote for cyanide poisoning. So I don't recommend anybody get cyanide poisoned, but methylene blue is an antidote for that as well, because it can actually compensate for the destruction that cyanide does to a part of the electron transport chain. So it works by making more energy and helping more energy and compensating for that. But it also works directly as an antioxidant. So it can help actually combat, or it can help neutralize that oxidative load happening on a regular basis for all of us, but significantly in a hyperbaric chamber too, as you can imagine, because of that. So it's a dance, right? You don't want to give a huge amount of antioxidant capacity with something like methylene blue or even hydrogen, like we talked about. But some can be very helpful in people that are already under significant stress. And methylene blue is not the only thing that I'll use in these patients. Sometimes I'll actually use straight up antioxidants in some people that are super sick. But the awesome thing about it is that it compensates for mitochondrial dysfunction in almost any capacity. And so then I start using it early in my clinical practice, and I can start getting them in a hyperbaric chamber relatively quickly as a result of that, because they start feeling better, and I know that they're more supported, while they're doing other things, of course, at the same time. And I can talk about methylene blue for about 17 hours, but in general, the way I use it in clinical practice is for mitochondrial support. And then also it's also being used now in the elite performance world, because we have significant clinical experience where methylene blue doesn't just compensate for mitochondrial dysfunction, it can actually build and increase your aerobic capacity, it seems, as well, because it can just act like oxygen in your cells. And I mentioned that earlier, is that methylene blue can act just like oxygen and become the final electron acceptor in the electron transport chain on complex 4. And so it can maintain aerobic capacity for longer. And I found this out clinically with working with a couple of my patients who now refuse to work out without methylene blue because they can keep their heart rate up for longer. I work with a guy here in Colorado that did the ultramarathon Leadville race, 100-mile race. And I had him taking 32 milligrams of methylene blue every 4 hours. And he decreased his time by 3 hours from the year before. He also had less diarrhea, which was another reason he probably didn't take as long to finish. But that was from a different modality, different intervention. That was glutamine, actually. That's a different one. But anyway, that's a different story entirely. But so the methylene blue can really support endurance. And we also think that potentially, this is kind of a new one that I've been building out with a colleague, is that the idea that you can recover from a workout or intra-workout even at a higher heart rate if you have methylene blue on board, because it gives you the support you need so that you don't need to drop down to a lower heart rate to typically recover overall. So it gives you the capacity to recover at a higher heart rate potentially as well.
Fascinating. All right. So I've been at several conferences with you and your colleagues. You guys are handing out these little blue doses, and people are walking around with their tongue blue and stuff like that too. So that's kind of fun. If people see that now, they'll know what it is. It also, as I've learned firsthand, can give a little bit of a blue tint to your urine for the next day or so.
Yeah, so methylene blue concentrates in your urine, and so it will be blue depending on how much you take. The more you take, the higher your blue urine count or level will be, I guess, overall. Low doses are super effective for most people. 4 milligrams, 8 milligrams, 12, 16. These are more mitochondrial optimization doses. If you're taking higher doses over like a milligram per kilogram, which is around 70 milligrams or so, that's more of an anti-infective dose. It's more of a dose for significant stress or trauma or low oxygen states. And I use it in those capacities, but more frequently I'm using it at the lower doses overall for mitochondrial support, endurance, chronic inflammation, those kinds of things. And like over the last 5 years that we've been using the products, lots of great stories from patients and customers. And it's been pretty transformative overall for a lot of people. Less pain, less inflammation, better brain function, less brain fog, better concentration, better muscle capacity. So less exercise-induced fatigue too.
Awesome. And we mentioned it before, but now that we're talking about it in this moment, that company is called Troscriptions. Like
Correct.
prescriptions, Troscriptions.
Yes, the word troche and the word prescription mashed up into Troscriptions. Our delivery device is called, or dosage form is called a troche, and it's a dissolvable lozenge that goes in your mouth that dissolves. But if you don't want a blue mouth, you can also swallow it on an empty stomach, and that works almost just as well. If you do have brain-related issues, you might want to dissolve in your mouth and just kind of see how it goes, as long as you don't mind being a little blue. We have some remedies for that on our website and Instagram and other info areas too, I would imagine, too. Help desks, things like that.
Awesome. As we transition towards beginning to wind down here, Scott, can you share your NeuBie story actually with everyone listening?
I would love to, sure. And so the first time I met a NeuBie provider was during the pandemic. His name was Joel, nice guy, really great guy, actually, former policeman, actually, in San Francisco. And I don't know how we first started talking. I can't remember the backstory there, but it was during the pandemic, so you couldn't go anywhere. Like you just go to people's houses. And my friend Pete Bauman, who you know as well, Pete had a place in Berkeley, and they had a hyperbaric chamber. It was my hyperbaric chamber, actually, because I didn't have enough room in my house for it. So I used to go to Pete's house to use hyperbaric therapy during the pandemic and after, before they moved and I moved. And so one day I was talking to Joel. I don't remember how it came up, but I was like, I had just injured my back maybe about 6 months or a year ago, L5S1 disc herniation. I was still having a lot of challenges. I was not in a good place overall. And so Joel had me doing all these crazy things with the NeuFit at the time at Pete's house. And then after his session was the first time in about a year that I'd been pain-free and I was pain-free for three days. It was 3 glorious fucking days. It was great. And I was like, whatever that was, I wish I could take that at home with me and use it more frequently. And only now do I understand why. I know like various things that why it worked, and you can tell me more, of course, why as well. But I realized over the years that it's not so much the nerve that's the issue. It's actually the muscles around the nerve that are the major issue, right? And so if I work on like my psoas and like everything gets so tight, right? Like my psoas muscle especially. And so I've worked on like many things over the years. Obviously a lot of core strengthening that's helped too, but psoas release techniques have been like the major like light bulb over the last couple of years. But at that time, I had no idea what a psoas really. I mean, I knew what it was, but I had no idea. So, but anyway, it was like the first 3 days that I'd been pain free in like a year, and so I was very grateful to Joel. And you have a fantastic technology, man.
Awesome. Thank you so much. And I'm excited for opportunities to pair it with, the various things that you're doing too. If anyone listening to this was like, hey, you know what? I've thought about adding some more lines of business or cash-based wellness services or
Yeah.
complementary technologies. And they're like, I would consider getting a hyperbaric chamber in my physical therapy practice or chiropractic clinic. Can you talk to people real quick about what the options are? And, you mentioned different pressures. You mentioned there's soft and hard shell. Just, a minute or two on how one would think about looking at the different options, cost benefit analysis, et cetera.
Yeah. I mean, so I have a company called One Base Health as well. And One Base is a company that I started about 4 or 5 years ago to really create more education and options for people in the hyperbaric space. It's actually evolved into more than that now. But if you're looking for a chamber, you can go to onebasehealth.com and they can give you like a rundown. There's actually a physical therapist. His name's Jason Hahn. Jason is the guy that does a lot of our sales, and he can run people down kind of what they need. And he has 4 or 3 soft shells in his chamber, in his facility in Pasadena. It's called Health Fit LA, I think. And so people can check that out and talk to Jason, and he could give like a full rundown of how he uses in physical therapy. And in essence, like the mild units are typically the ones that are easier to start integrating. The deeper pressure chambers sometimes require more build out. They require medical directors sometimes, depending on the situation. So, but in essence, I think it could be a fantastic tool. If you're seeing more people that are sort of healthy, optimized, like mild injuries and things like that, the soft chambers are fantastic. If you're seeing a lot of people with like chronic autoimmune issues and like, wounds, like you may want to be thinking about like a deeper pressure setup overall.
Rapid fire here. If there was one test or top 3 tests you think everyone should run annually, what would that be?
I see you're going here. So what I typically do in my health optimization practice is I run a full metabolic profile. It's something called the Nutraval metabolomics. It's a metabolic profile for my patients every year or every 6 months. I also do a stool test on them every year as well, looking at their gut microbiota, their gut integrity. Those are 2 that I use primarily. I think and then I usually use, depending on how old you are, like an advanced hormone panel as well would be really good. Just to kind of, and if you're on hormones, you need to get your hormone panel checked more often than every year. But advanced hormones, especially after you get to the age about 40, 45, where I am and and things, I think it's usually good to start doing hormones, at least kind of seeing where you are every year or so if you're not on hormones, to see what's going on. So those would be the 3 that I use.
Awesome. If you could shout one message from the rooftops or put a billboard out there that everyone would drive by and see, what's the one message you would put on that?
That's a good question. What comes to mind right now is just 4 words: calm the fuck down. So, and we're always on all the time, and learning how to turn off and relax. We have a whole suite of products and prescriptions that are related to the GABA system, which is our system that, in a neurotransmitter system that helps us relax. And most of us are not giving it what it requires to truly balance that autonomic nervous system that you were talking about earlier. So calm the fuck down, learn how to be parasympathetic. God damn it.
I love that. If my daughters are listening to this, I'll beep that out. I'm just kidding.
Sorry.
All good. I love that. That's a great message. We talked, in prior conversations and before hitting record about the importance of autonomic balance, of the parasympathetic nervous system, is so vitally important. That is literally the state in which we have to be for any sort of healing, regeneration, repair, adaptation to take place. So that's great. Yes, a good message on which to end it here. So you mentioned already transcriptions people can look up. You mentioned onebasehealth.com. Mm-hmm. Any other resources that you'd like to share with people?
So my personal stuff. So I have, if you're interested in consulting with me from a hyperbaric perspective or from a health optimization, you can go to integrativehbot.com. That's kind of like my personal consulting website. I also have another, I think that's probably good enough. And then if you're interested in the nonprofit, you can go to homehope.org and you can check it out if you're a practitioner, if you're a physical therapist, if you're looking for an additional source of a way to optimize your patients and create foundational health. You don't have to be a doctor. You just have to be somebody interested in biochemistry and knowledge and data. Check out homehope.org and you can sign up for one of our modules. The foundational module of all of them is metabolomics. And then every 3 times a year. We do a cohort style where you can work with us on a weekly basis for about 12 weeks and have a virtual meeting and do consults, do lessons of the week, and also do case reports and journal clubs and things like that. So
that's awesome. Scott, you're awesome. I appreciate you coming on, sharing your wisdom with NeuFit Nation here. It's been a blast. Thank you so much.
My pleasure, sir. Until next time.
Yes. And thank you for tuning in to this episode of the Undercurrent Podcast.